Gene, what are your expectations for when you're going to start to receive a vaccine and start using it?
Well, we're very excited that we're entering a new and hopeful phase of the pandemic. We anticipate that the vaccine distribution is just a few weeks away. Nothing is going to mean more to me personally than seeing my frontline workers who are literally exhausted at this point receive their first doses of vaccine. It'll be the highlight not just of the year, but of the decade. But we are locked and loaded, ready to fight this virus. We have refrigeration units that can store on day one 300,000 vials. We also are training staff as we speak. So as soon as the protocols get released by the CDC, I know they're meeting today, we'll be ready to go.
Dr. Markovich, do you feel prepared as well in Ohio?
I think Gene set it up quite nicely. We're ready. We're anxious for the vaccine at Ohio Health. I think across the state of Ohio, there will be 10 pre-set-up places that are set up to distribute, and Ohio Health has 2 of those. So we're working on the protocols, working through the triaging of people, and it's going to be an exciting time. It's really, hopefully, going to be the beginning of the end. It won't be easy. It's not going to be fast. It'll be complicated, but I really think it's going to be a very exciting time.
Yeah, Dr. Markovich, the end of the end here, at least, though, is proving to be pretty difficult. What are you seeing on the ground in terms of new cases and hospitalizations in your area?
Well, unfortunately, in Ohio yesterday, for hospitalized patients, we tripped 5,000. That is a 200% growth in hospitalized cases since the 1st of November. So it's a big challenge for all the healthcare systems across the state. Right now there are 700 people on ventilators across the state. In my own system, we've got nearly 400 people in the hospital with COVID and another 350 who are being ruled out for COVID. So we have to treat them as though they have COVID. So literally, I've got 25% of the bed capacity in our system that's consumed with COVID, and all the protocols and preparation and PPE that gets consumed in caring for those patients. So we're doing the best we can to manage our capacity on a hospital-by-hospital basis. We have deferred some elective surgeries and elective procedures in order to create capacity and best optimize the use of our staff. But people are tired. I wouldn't say they're anxious. I think they feel supported, but they're mentally and physically pretty darn exhausted. And we really need to once the vaccine gets out, we need to really push on the population to get as many people vaccinated as possible.
Mr. Woods, there was some reporting this week about people who were in the hospital, sick from COVID, who not only doubt the severity of COVID across the country, but believe that hospitals have a financial incentive to classify patients as COVID in the name of profit, which was something that the president even said on the campaign trail. What do you tell those people?
Yeah, it's really unfortunate. I mean, I think we're in the hole several $100 million as we fight really the biggest healthcare battle of our lives. And we've taken a huge financial hit. I can tell you there's no physician or nurse or caregiver that I know that is doing this for financial reasons. We're all doing it because we want to be here for the community and the patients. And we're still engaged in fighting this. So I think the reality is that we're having to make sure that we have enough resources to really continue this fight. We're seeing the same thing in North Carolina as is being seen throughout the rest of the country with high watermark levels of hospitalization. So right now we're focused, and we know there's some conversation today in Congress, but we're focused on ensuring that we get the next level of support for hospitals, because we really need to be here for the communities here in the next several months as we continue to battle this and the vaccines get distributed more broadly.
Shepard Smith here. Thanks for watching CNBC on YouTube.